Although the rate of teenagers having or aborting babies in the United States has significantly dropped, the United States throughout history has had the highest number of pregnant teens. The United States makes up nearly 3/4 of the world's teen birth rates, and nearly 1 million American teens have become pregnant each year. Teens and parents need to be realistic when they're considering the risk, as well as the effects of teenage pregnancy, and more importantly, they need to be aware of the many options to prevent pregnancy, such as contraceptives and abstinence. Parents are responsible for ensuring that their teen is informed, aware, and protected. Parents and teens need to understand the importance of information about being sexually active and contraceptives, the risks of lifelong effects of having a child at such a young age, and obviously they need to know how to get access to contraceptives. Out of nearly 1 million teen pregnancies each year, approximately 30% of those pregnancies end in abortion. Contraceptives and accurate information could have prevented those pregnancies. Contraceptives are the only thing that can prevent a sexually active teenager from becoming pregnant. Every parent dreads the talk. It's an awkward conversation for both the young adult and the parent, but it must be done. This is where the parental guidance comes in. Parents should research information about contraceptives and be prepared for this conversation. Maybe they should research teen birth rates and sexually transmitted diseases. Be very open and have a well-rounded discussion. Be sure they fully understand. We need to remember that teenagers cannot always make the best decisions, and they are capable of lying to a parent if asked if they are sexually active. So whether they say they are or aren't, go ahead and have the talk. Parents cannot force a teen to take contraceptives, but they should certainly encourage it if their child is sexually active. Parents can talk with their child, make the appointment for them to see a licensed professional, even if that's just to seek more information or discuss the importance of contraceptives with the physician. Parents may feel that they are afraid or alone with this decision and discussion, and having a licensed professional on their side there to help them kind of help explain the importance may encourage the teenager to make a wiser decision concerning the use of contraceptives. A sexually active teen who is not using contraceptive is highly at risk for becoming pregnant and needs to be well aware of how having a child before they themselves reach adulthood can impact their lives, the lives of those around them, and the risks that would come with being pregnant and parenthood at such a young age. Teens do not have an understanding of the full responsibility that comes with having a child. It makes it very difficult to go to school after being up all night with your screaming infant. Without a high school diploma, in today's world, you don't stand a chance at finding a job to raise your family, to support a family. Babies and children are very expensive. You have to buy formula that costs anywhere from about $20 to $200 per can. And, that could range up to the $200 because some babies have to have a certain formula. Diapers cost well over $1,000 per year. From the time pregnancy occurs, you only have a matter of months that you have to prepare. You have to purchase a crib, a car seat, clothing, hygiene products, bottles, pacifiers, diapers, wipes, blankets, beddings, special laundry detergent, bibs, burp cloths. That list is never ending. And when it comes to having a child, that list is just going to keep growing for the next 18 years. It only gets longer. Having a child to care for can nearly make it impossible to have a chance to follow your dreams or even succeed or have a stable life. Not only for you, but for this new child. Not only is there the risk of the teen's life being drastically changed or hindered, there's also the risk of pregnancy complications and birth defects for babies born to teenage mothers. It's proven that the younger you are, the more risks that there could be. A few of these risks are to have high blood pressure, along with all the complications of that during pregnancy, premature births, and very often you see low birth weights in young mothers. To prevent teen pregnancy and all of its risks, lifelong effects, and possible complications, simply use some form of a contraceptive, whether it be birth control or there's a shot you can get. You can use condoms, just anything to help prevent conception. Every female in the United States has the option and the right to use a contraceptive to prevent pregnancy. You simply make an appointment to talk with a physician about the options of contraceptives, get well informed, and make a decision. Maybe parents don't have insurance for their children, or they can't afford birth control, they think. There are options for these situations. You can go to a local health department and pay a very low, income-based, one-time annual fee for a checkup concerning your women's health. And you can choose a contraceptive method right then and get a supply for birth control with no other charges. Many people are unaware of the options that are out there to help those who can't afford birth control on their own. Parents need to be active in assisting their teenagers in setting up these appointments and to at least discuss the contraceptives. Parents should be encouraging to the use of contraceptives, ensure the contraceptive is taken and correctly used. Teens may lie about being sexually active to their parents. Encourage the teen anyway. If they really aren't sexually active, they need to be prepared for when they make that big decision to become sexually active anyway. Parents need to always remember they are the responsible ones for educating their teen and helping them make a healthy decision that can impact the rest of their life. Parents and teens should both have a clear understanding of their role in preventing teen pregnancy. We are now well informed about the responsibilities that come with sexually active teens, how contraceptives can relate to those responsibilities. We know how the lives of teen mothers can be impacted and the risks in teen pregnancy. Above all, we know we all have the right and access to contraceptives and information about contraceptives. So let's remember to be realistic when parents and teens discuss the many risks of teen pregnancy. Parents are responsible to ensure that teen is aware and has had access and knows how to use a contraceptive, to ensure that they are well informed and protected. We cannot change the past or present in our country right now with the teen birth rates, but we can make a difference in the future of our country. There are almost 1 million young women in America who are going to be pregnant this year alone. Let's get this number down. The number of pregnancies has begun to drop. Let's keep it dropping. Use your rights. Use contraceptives and be safe. Thank you.